How can stroke patients take blood thinners without severe bleeding? Imagine trying to prevent a dangerous blood clot from forming while also avoiding causing a bleed that could be life-threatening. That's the delicate balance doctors work with when prescribing blood thinners to stroke patients. These medications are essential for reducing the risk of future strokes, especially in people with conditions like atrial fibrillation, but they do come with a risk of bleeding. So, how do healthcare providers help patients take these medicines safely? Blood thinners, or anticoagulants, include older drugs like warfarin and newer ones called direct oral anticoagulants. Warfarin has been used for decades, but it needs regular blood tests to keep the dose just right. The newer drugs, such as apixaban, rivaroxaban, dabigatran, and edoxaban, are easier to manage because they requiring less frequent monitoring. These medications work by interfering with how blood clots form, making it less likely for clots to cause strokes. But because they slow down clotting, they can increase bleeding risks, from minor bruises to serious brain hemorrhages. Before starting blood thinners, doctors carefully evaluate each patient's individual risk factors. They look at age, kidney function, history of bleeding, other medications, and overall health. Tools like the CHA2DS2-VASC score help estimate the chance of stroke, while the HAS-BLED score assesses bleeding risk. This helps doctors decide who will benefit most from blood thinners and who might need closer monitoring or alternative strategies. Timing is also crucial. After a stroke caused by a clot, starting blood thinners too soon can increase bleeding into the brain. But waiting too long leaves the patient vulnerable to another stroke. Recent research shows that for many patients with atrial fibrillation, beginning a direct oral anticoagulant within a few days after an ischemic stroke is safe and effective. This approach helps prevent second strokes without significantly raising bleeding risks. It's a shift from older practices that recommended longer delays. If a patient is already on blood thinners when they have a stroke, doctors now have more confidence in giving clot-busting drugs like alteplase. Recent studies suggest that giving alteplase to patients on direct oral anticoagulants does not significantly increase the chance of severe bleeding and can improve recovery. This means more patients can receive this potentially life-saving treatment when needed. Monitoring is key to safety. For warfarin, regular blood tests called INR checks ensure the dose stays within a safe range. For direct oral anticoagulants, kidney function and other health factors are checked periodically, even though these drugs need less frequent testing. If bleeding occurs, the medication dose may need adjustment or temporary stopping, but always under medical supervision. Patients can also take steps to lower their bleeding risk. Avoiding activities with high injury risk, being cautious with other medications like aspirin or non-steroidal anti-inflammatory drugs, and reporting any unusual bruising, blood in urine or stool, or prolonged bleeding are important. Keeping blood pressure under control is also vital because high blood pressure can increase the chance of bleeding in the brain. In some cases, if blood thinners are too risky, doctors might suggest alternatives like antiplatelet drugs such as aspirin, though they are less effective for stroke prevention in atrial fibrillation. For certain patients, procedures to close off the part of the heart where clots form, called the left atrial appendage, can be considered. Ultimately, the decision to use blood thinners after a stroke is a personalized one. It involves a detailed discussion between the patient and healthcare team, weighing the benefits of preventing another stroke against the risks of bleeding. Each plan should be tailored to the individual's health, lifestyle, and preferences. Ongoing research continues to improve our understanding of how to best use these medications. New drugs and reversal agents are being developed to make treatment safer and more effective. With careful management, regular monitoring, and personalized care, stroke patients can take blood thinners with a much lower risk of severe bleeding, helping them stay healthier and reduce the chance of future strokes. Always remember, it's essential to work closely with healthcare professionals to find the safest and most effective approach for each individual.